Good evening, and thank you all for attending the last ASF Virtualpalooza. I have to say it has been such an honor and a pleasure to be with you the last 3 weeks every evening. I will miss seeing your faces every night at 8 p.m., but I really, really hope that you've enjoyed this time together. And just want to remind you all that all of the sessions are now uploaded, and we'll upload the session for tonight later, but everything is now on the ASF website under the ASF Virtualpalooza conference, and you can access all the webinars, all the presentations, the Q&As, everything that you need. If you missed out on anything, you can go back and check those out. As always, please, it's my last time to beg you all to sign up for the ASF National Walk, the virtual walk coming up. Our rally will be on September 5th. We have a lot of stuff in store for you all, so please make sure that you go to our website and check that out and sign up for it. You're in for another treat tonight. One of our amazing clinicians has created an amazing resource that you guys will have first eyes on and first access to before anybody else. So we're so happy to have Dr. Lynn Bird here tonight. Dr. Lynn Bird's been with in the AS community for, gosh, Lynn, has it been 10 plus years?
Almost 20.
Oh my gosh, so 10 plus, I was right, 10 plus 10, 20. So she is so knowledgeable with our community, and it works tirelessly to do what she can to provide the best clinical care for our community. So we also have Michelle Harvey Martin on with us tonight as well, because what has been created is something that can accompany your IEP, and we all know that Michelle is our IEP expert. So we have two people on the line tonight that can help you in so many different ways. So I'm going to pass it on to Lynn, but keep in mind, go make sure you ask any questions you have. Tonight is the last night that question box will be open for you all. So I'm going to go ahead and I'm going to pass it over to Dr. Lynn Bird. Thank you so much for being with us.
Well, it's a pleasure to be here, and I just wanted to, this will be a really short session so that everybody can get on to their weekend. But I just wanted to introduce a tool to you that is not my idea. I went to a Prader-Willi conference in November, and they presented this incredible tool there. And I asked the person who had headed up the committee that formulated this if I could steal the idea and adapt it for Angelman syndrome, and they were very gracious and very happy to do that. So this idea is shamelessly stolen from other people, and I am pleased to say that we had input from several individuals, both at ASF and FAST, particularly Michelle, who's with us here tonight. So let's get started. This is a 4-page document, and it is, this is what the top of the first page will look like. Your physician would enter in the name of your child and birth date, and there's a place to indicate the flavor of Angelman syndrome, deletion, UPD, whatever, if it's known. And then it just gives a really tiny introduction about what Angelman syndrome is, but refers the reader to the 2 websites for resources. And then as you scroll down further on the first page, just in alphabetical order, we've listed the symptoms that are present in many, if not most, or sometimes just a few patients with Angelman syndrome. And you'll notice on the left side that there's just a checkbox there, and your physician could then just check off what applies to your particular child. And on the right side, for each symptom, there's a little description of what the symptom means there in column 3. And then the 4th column over has some potential services, support, interventions that one would apply to that particular symptom. And then on the last column, there's a place for your physician to personalize this for your child. So for example, if anxiety was a problem and we happen to know that there are specific triggers for that, that could be written in there. And if there's anything that you've been doing that really seems to work to prevent anxiety or to improve it after it started, then you would put that in there to give the school a little bit better, more tools to do a good job. So then there's a couple more pages. Tried to make it as short a document as possible so that it wasn't overwhelming to anybody. And thanks to FAST for helping me pare down quite a bit on that. So again, you would just click off some things. May just give the school a little bit of tip about, hey, we've got extra bandanas in the backpack if you need them for dueling. And just tick, tick, tick what you need to do there. Now, recognize that these things that even though I called this a physician's order, and the things that your physician may write in are things that he or she thinks is important for your child, recognize that we don't have control over what the school does. Not every school has the same resources. So I don't want to give anybody the impression that, oh, because a physician signed the order, it's all going to happen. And Michelle can give us some more insight into that probably. This is the third page, I think. Again, just tick off some things and whoops, I got that in the wrong box. And then the last page has an area for other symptoms that we failed to include that you can write in and your physician can write in. Now, being a physician, either we are inherently lazy or we are maybe overworked, but all of us love something that is just super fast and super easy and just tick a few boxes, sign it, and you're done. So the most you can do to prep this for your physician so that it doesn't, take a huge amount of time, I think will make it more successful. And then after everything's been ticked off and all the little extras have been written in, you get down to the bottom of the last page, which is where the physician would sign and date it, would put in their contact information in case there are any questions. Physicians can't talk about specific individuals unless the parent has signed a release of information form, but we could certainly give generic information about Angelman syndrome if it's needed, or talk specifically about an individual if the parent has given permission for the physician to share that with the school. So real quick overview, this is meant to be a living document. It is something that is not set in stone. Your input is definitely welcome. Please send your comments about how to make it better. It's a toss-up between trying to provide as much information as possible, but also keep it a manageable length document. But if you've got ways to trim in some areas so that we can expand in other areas, that would be fantastic. And now, I'd love for Michelle to give us her take on this and tell our listeners where you think this might fit.
Yeah, so one thing that first comes to mind is some districts will institute or attach to the IEP an individual health plan, whether that's the official name for it or I always come back to it's usually just called some sort of health plan or IHP for students that have more intensive medical needs. So if there's a lot of boxes checked in this form, and the school nurse is heavily involved with all the medication that's ongoing throughout the day and feeding tubes, all sorts of things like that, the IEP team and or the nurse may have a health plan attached to the document or on file in the office, something like that. That would also probably list some seizure protocol as well. And this would fit nicely in there to kind of help inform that. And Lynn, I appreciate you letting us know that doctors often, check. I totally get this for that purpose. And then adding in the specific notes over there on the side is great. And then like Lynn said, the things like, occupational therapy, a one-on-one aid in particular, is where I could see there being a little bit of potential for families thinking that because the doctor said it and we have this signed document that the school will implement this. And I just wanted to point out that schools have their own assessment methodology protocols for all the related service areas, for how they assign one-on-one aids, how they determine the need for a one-on-one aid. And so this document wouldn't automatically grant that, but having doctors' input as the school IEP team, especially with Angelman syndrome being less, on the rarer side, people often haven't heard of it. Educational teams may not have had a student with Angelman syndrome previously, and so this is a lot of good information for them to have and just be aware of in general. I think that's everything that I could touch on from the IEP standpoint.
What I was thinking too, Michelle and Lynn, this is a great document, period, for people, right? Like,
right.
I could see this giving this out to, your caretakers, your respite, your OT and PT and equine therapy. I mean, it's a great tool for people just to kind of learn a little bit more about what the child is experiencing, right?
Yeah, and keep a laminated copy in the backpack. If the child is going from school to therapies after school with a different care provider, in case of emergency situation, that these are possibilities. The boxes that are checked are things that this person really encounters frequently. So something like that could be beneficial as well.
When I was also thinking, Lynn, can you give some advice to the families? Because obviously a very small percentage of our families are able to get to an AS clinic, where some of the clinicians may be more inclined to spend time actually completing this, right? So how would you advise them having a conversation with their neurologist, the developmental pediatrician, whoever they may take this to work through, to get them to start that conversation to use this tool?
So I would just suggest if you come in with the document and maybe have it filled out in pencil, have the boxes checked that you think apply to your child, I think you'll get very little pushback from a physician on saying, oh no, this isn't really an issue for your child, I'm going to erase this.
Right.
They can just go over the pencil with pen, and you can even suggest some things to write in on the right-hand side. In my experience, most physicians are all too happy to do these things that help. They just don't really have the tools usually, and the idea that they're going to write a 2-page letter to explain all this, that's going to fall to the bottom of the to-do list because there's a lot of energy of activation that would be needed to get that started. So what this is designed to do is hopefully take away the work a bit so that it gets done. You're absolutely right that I think this document doesn't necessarily, it certainly shouldn't be restricted to use in schools. That wasn't its intention. And I do have a longer version of the document that includes some more things that wouldn't be applicable to the school setting, like anesthesia.
Oh, okay.
Things like that. So we can sort of put together the kind of expanded version of this too, that might be useful. And many times when I'm dealing with families who have children with rare disorders, some of the disorders have the American Academy of Pediatrics has put together guidelines on health supervision for the condition. And I think there is a plan to do that for Angelman syndrome. But
Yes.
what I often do when I'm seeing families is I will give them a copy of those guidelines. I'll give them 2 copies, in fact. I'll say, this is for you so that you can follow along with your physician to make sure that everything is happening at these regular visits that's supposed to be happening, and give the other copy to your physician to put in the chart. Now,
Yeah.
worked better when we had paper charts. Now that we're
Right.
electronic, but still, it can be scanned in. I like families to be the drivers because many times you guys are the more knowledgeable of the parties. The physician, has the credentials and the ability to sign the order, but your child may be the only child with Angelman syndrome that this physician's going to see in his or her career.
Right. Well, and the other thing, I like the idea of an expanded version, because the one thing that we are trying to work on, and now we don't because you've created this awesome resource, is that a lot of families want to be able to jot down just standards of care for their kids to have just in case, right? Like, so having that expanded version that really a family can kind of articulate every form of instructions and interventions for the specific areas, I think is really important, because we just never know what's going to happen to us who are the caretakers, or in what instance we would need this kind of document to be able to give. I even think now of, some states, I don't know if they're still doing it, to where if you have to go into the hospital, you have to go by yourself. So this is a great form too, if it's completed, that could go with the families and support in that way.
Yeah, and we can certainly make an expanded version of this that includes all those other areas that weren't particularly relevant for the school day.
Yeah.
And also, expand on some things like, because of the communication deficit, this person needs to have an advocate with them all the time.
Right. Yeah.
And so what we're really gonna count on is that we get a lot of input from the community. And I've tapped a few people, but there's no question that the more eyes looking at this, you'll probably find typos that all 5 of us missed. So we can certainly, I'll work on the expanded version. We can upload both versions to the website and then invite feedback.
I think that's a great idea. We're getting a lot of comments in the question box of everyone saying we'd love to have an expanded version. And just for you guys too, we are going to work on getting this translated into Spanish as well, because that's been asked for. So we're going to, I have someone that can do that. Lynn, I don't know if you knew that, but I'm telling you now that we have someone that can work on it. Translating this all into Spanish, and then we'll work on other languages as well. Michelle, something's come up, and I think it's just maybe you can give some people some confidence in their IEP team. The questions that has come up is, how likely is it for the IEP team to really spend time and read through this?
So having this be just a couple pages is great. And especially if you're only looking through, as a teacher, and I'm getting this, if I were to be getting this document, especially with it being a less known disorder, I think it is very likely. I think the instances in which this would be more likely to be really read through is initial assessments. So for our kids with Angelman syndrome, usually they're identified pretty early that they're going to need a lot, at age 3, they're doing the kind of the intake with the school system, where they ask, I'm sure some of you have filled this out a couple times, background information and how was your pregnancy? And gosh, I'm just thinking of all the different things that I've seen, parents have to write. And then you update that every 3 years in the triennial, right? How great if you could check this and submit this with that background information as part of the triennial IEP, and then you have less to like hand write onto those forms, and you could see every 3 years what has changed in terms of the symptoms. Another way, I know on California IEPs, and actually when I worked in Tennessee, that there was a spot for this as well, there's a space for any relevant medical information in the present level section. So that's where, if I have students that are taking certain medication, or I had one student this past year, asthma, and we note on there that treatments are available in nurse's office as needed, all that kind of stuff. I mean, this is a great, as I'm writing the IEP, if I have a more medically fragile student, taking the terminology directly from this document and putting it on there right in that medical section, then I don't have to ask the parents the extra questions. I don't, just because all of sleeping issues, maybe tired, all of that can just be copied and pasted easily in there. If you happen to be getting pushback, you can always, just like Lynn said in, the medical charts, this could be uploaded. This can be scanned and uploaded as well into the IEP document, or like all the records for that particular IEP. If you think a formal health plan should be developed and they're kind of saying, oh, we don't really do that, you could ask for this to be included in there, put a copy of this document in with the notes, the IEP meeting notes. So there's multiple ways that this could be beneficial for the team to look at, to help get to know the child and everything that's impacting their day-to-day, kind of function at school.
Absolutely. Well, I think it's an awesome resource. Dr. Lynn Bird, do you have any final words of wisdom? I see, let me make sure there's a question. Oh, so someone just asked if, just to confirm, can this be attached to the IHP? I don't know if I know what an IHP is.
IHP, I would call individualized health plan, right?
Okay.
So I don't have a the IHP is more district specific on if they have a formal document for more medically fragile students that they attach to IEPs, or they have copies of in the nurse's office or things like that. It may be more school nurse driven. But I would assume that this information should all be in IHP if they have a formal health plan. And if not, you could ask for it to be uploaded into, the IEP file. IEP files are often different from the school cumulative file, they'll call it. So you could ask for a copy of this to be put in the cum file, which is likely where, if there's, more a formal health plan might be in there. So I think used in tandem with an IHP would be beneficial.
Perfect. She says thank you.
Okay.
Okay. So Dr. Lynn Bird, any final words of wisdom as people now? I will tell you, everybody that's on, the handout is actually within the handout section on the tools, so you can download it right now. We'll work on an expanded one, but it's also on our website as well under her talk. And then it will be moved under to our IEP section, our IEP bank on the website. So any last words of wisdom from both of you as people move forward with using this document?
No, just we really want to hear from you about how it's working and how to make it better. And the other thought I had, which is probably dreaming, but maybe at some point we can have an electronic version of this where you could tick off the boxes that apply, and then you could print out a copy that would just have the relevant information.
That's a good idea.
Yeah, I don't know how doable that is. I'm not really very techie, so probably what I'm describing, it sounds simple, but maybe not. So, but anyway, paper always works for me. So if paper works for you, then just print it out and have one of your physicians fill it out. And the more you do in advance for them, the happier they'll be.
Absolutely. We're getting a lot of thumbs up, so we're super excited that this resource is something that you guys are excited about and that you can use. Once again, at any time, if you need any help or any support in any of this, feel free to also reach out to Michelle Harvey Martin, as she is a resource director for ASF, and she'd be more than happy to walk through this with you. And I'm sure that Dr. Lynn Bird would be more than willing to answer any questions as well for you. And I also see that our great friend Win Han is on as well. And I just have to give him a shout out because he is always so dedicated to this community, and he is a partner in crime with Dr. Lynn Bird. And so I'm sure that he'd be more than willing. I'm going to go ahead and volunteer him if you guys have any questions that he can help out as well. I'm sure he'll appreciate that. But I just want to thank both of you, especially Dr. Lynn Bird, for taking the time to, even though it was something that was created by another group, seeing the vision for it and seeing the importance for our foundation, for our community, and putting it together. Thank you so much for taking the time to do that. Winhan just said I embarrassed him. Sorry, Winhan, we love you. But thank you so much for just taking the time to put this together. I see this as a game changer, and I think it's going to be a great document for people to use. So with that, with that, Dr. Lynn Bird and ASF and FAST will continue to work on this document. Like she said, send any feedback you have for us, because we will continue to grow and develop this as we go. And then we'll work on the expanded version, as well as we'll translate these versions as well. So stay tuned for that. So this is my sad time to tell you, this is the last time that we will be together, at least for the next 3 weeks. We will have many more webinars and stuff coming your way in the future, but I just want to thank you. I wish I could actually point out a few people who I've seen almost on every single webinar in the last 3 weeks. Like, that's dedication. So thank you. So there she is. That's dedication. And I just thank you for taking your time to learn more and to grow. And you will be receiving a survey, so you can tell us how we can do better next time. We will be doing a lot more of these webinars as we move forward, because we know that this is really important to continue to educate the community as much as we can. So make sure you fill out that survey when it comes. We also, the t-shirts are in, so they're going to be mailed out to each of you. Everyone who attended at least one session will be getting their awesome ASF Virtual Palooza t-shirt. So when you get it, please make sure you take a picture, show it to us so we can check out your cool new swag. We love you all so much. We are here for you. If there's anything that we can do at the foundation to continue supporting you and your family, please make sure you reach out to me or send us an email at info@angelman.org. Until then, I hope you have an amazing weekend. I hope you stay very safe, and we will see you soon. Thank you all.